Associate Director of Strategy at an NHS hospital and the author of Innovation is Dead. My career's a bit crazy. You couldn't, you probably couldn't make it up. So my undergrad degree is archaeology. And I was then a professional archaeologist for a while, which sounds totally irrelevant to everything, but it's quite a multidisciplinary field. You've got to be up on your soil science, geomorphology, cultural studies, anthropology. You've got to be able to run teams, drawing different data sets. So when I gave it up and thought I'd wasted all my time, I probably haven't, as much as I realised. So I then did a master's in political communications. I joined the civil service, initially in the Department of Health, as it was then called before the social care bit got added, working for the DG Finance and then the Lord's Minister for a bit. Then I wanted to cut my policy and strategy chops, and the civil service internal job market is this awesome sweet shop of stuff. So I went and did policy for the UK launch programme in the Space Agency, so the policy for the international agreements on can we drop our rocket fairings over your shipping fleets, Denmark and Iceland, and some of the policy for the commercial stuff as well, so spaceports and launch vehicle operators and bring them together. Then I did some Brexit stuff. Then for the bulk of my time at the agency, I looked after technology futures and road mapping, including as the delegate to the UN and the European Space Agency for technology. Then I got dragooned into the shielding programme in the pandemic, so the 2.2 million people who were extremely clinically vulnerable, helping to deliver the package of support they required throughout the first wave of the pandemic. And then I joined the NHS, so initially in a new hospital programme in Hampshire, and now looking after strategy in Salisbury.
That's such a massive range of work areas. So your book is called Innovation is Dead. It's a provocative title. What makes you say that? Without giving it all away, because there's plenty of interview left.
Yeah, the enormous spoiler is that it's not dead, but it may well be on some kind of life support. The central thesis of the book is that there is plenty of innovation out there, and it talks about both aspects in my mind of the innovation that might be required in public services for them to be better, and how the public sector fosters innovation out in the private sector. So both are touched on, but the central thesis is that stuff's happening in pockets. It's just failed to be connected and spread. So in the public sector, that manifests itself as, in terms of public service delivery, as there might be something great going on with this type of surgery in Leeds, or King's Lynn in Norfolk might have solved their length of stay problem, but I don't know about that because I have no mechanism to get it, and then I don't have the skills in my teams to be able to adopt and adapt those changes to my local context. So, and that's not new ground that's been trod. The Health Innovation Networks have been saying that for a long time. But the difference is the middle management and the first rung of senior leadership have not really been offered the development to be able to step into that space confidently and start adopting proven innovation from elsewhere. And then how good the public sector is at fostering innovation in the private sector, that's an even dicier area. And I would just caveat this entire interview with, and I say it in the book, there are 999 better people to write this book than me. The problem is they're all busy, so I've done it. So if I sound like an expert, I'm not. There are people much better placed. But a lot of the difficulty with when the public sector tries to foster innovation in the private sector is the commercialisation valley of death bit. That's where we've fallen over. If I pick a specific example, Innovate UK used to have a commercialisation team for space technology. They take stuff that was at TRL 8, TRL 9, and help them commercialise it out into the market. They folded that team in about 2017, 2018, and nobody picked it up. So you had the Space Agency and the European Space Agency fostering all this stuff up through the TRL levels up towards market, and then stuff just dying when it was no longer required for either an institutional mission or it wasn't in receipt of a funding programme. So in the way that public service delivery has these pockets of stuff that can't be adopted elsewhere, public sector fostering innovation in the private sector has this challenge of it almost gets there, but it's not then adopted into the market because there isn't the support available for that last jump for a lot of SMEs.
Yep.
It's a really interesting question, and there are bits of it that are better than others. Like it's famous, the NHS is famously a bad place to bring something to market because everyone's got no money, no interest in taking risk. Lots of people who build health tech in Britain go and sell it to Dubai and Singapore and the US first and then come back to the NHS, or do pilots with the NHS, then do that, then come back. There are some good bits in defence. So Anita Friend, who's interviewed for the book, who runs DASA, They did some, and there's a case study in there of LiveLink, which is the Royal Navy adopting a piece of technology from civil technology and working together on exactly that, the development of the product into what they could use for it to then be something that gets deployed by the Navy and has them as a client customer. The difficulty with that, and I always wonder what policymakers in the MOD would think about this, is government the customer that we're seeking private sector organisations to serve completely? It's the classic thing of like the US claims it has this enormous private space market. It doesn't. It just has NASA issuing contracts. In some senses, they've just privatised a part of the public sector. And I think sometimes if we say to companies and SMEs, we will be your customer, and that's it, you're essentially a privatised wing of the military. We need to create we need to make sure that there's a diverse market for any products that are developed, right? Otherwise, we're just setting people up to fail if they lose their government contract.
Yes, there was another comment made that small businesses don't need funding, they just need contracts. But does that go against what you've just said?
I mean, I guess it's some and some. And I fully take that if you make something only a national military can use, then you are slightly hamstrung, right? But in that particular context, you'd be trying to help companies diversify internationally with allies. So we wouldn't hoard this. We wouldn't hoard Chemring's flare capability just for the RAF. We would make sure that they were able to sell to the US or whoever else. In cases where there are dual-use technologies, so if you make thruster propulsion tanks for satellites, you should be able to sell, obviously, it'd be great for you to have government contracts for military satellites, but it would also be great for you to be able to develop products for Airbus, TAS before they left, so that you've got that diverse market. And it's an open question as to whether or not it's government's job to wade in, right, on that development. It really is, because if you sit down a range of taxpayers in a room and say, how comfortable are you with your money helping a company develop a product that they're going to sell for profit in which you have no gain share? Like that becomes a political conversation, which we rarely have.
In your book, you mentioned curiosity, and I hear it mentioned often. But what do you mean by curiosity, and how to approach it?
Do you mean in the behaviour section?
As kind of near the beginning, I think you mentioned it.
I think in the context of innovation, and a part of this is couched in my particular experience of public services, which is not all of them, right? So I can't draw a conclusion about them all, but the ones in which I have direct experience, there is a cadre of leadership at the moment that is bought into the fact that problems are cyclical, they're perennial, this is the way it is, we just have to keep telling the lie to get through another year, and eventually something will change. And of course, completely putting to one side the fact that we are the people who are going to make it change. There's no one else coming. There's no white knight on the steed that's going to come in and save the public services. And the lack of curiosity prevents a lot of these leaders from saying, where's somewhere else that's cracked it? And sometimes they're well networked, right? So like nowhere in the NHS has cracked the fact that it costs more to deliver care than is provided by central government. But there are specific problems where we don't bother looking beyond the walls of the sector, right? So we have this problem with booking, we have this problem with flow through hospitals. How many leaders in the NHS have gone out and looked at the hospitality sector, which is very good at flowing its customer base through its beds, and very, very good at delivering intuitive booking experiences for customers. It's starting to unblock. A lot of the digital solutions are starting to help us get there. And more curiosity is being developed in the behaviour framework of senior leaders through some of the deployment of improvement methodologies, which is getting really popular in the NHS. But largely speaking, there is a layer of public sector leadership that is not sufficiently curious about what exists out there to radically change the status quo. Yeah, it's a good question. So some of the answer will be about involvement, and some of it will be about capability. I'll try and address both. So a lot of the ways in which change methodologies are similar, transformation, innovation, improvement, is the places where they succeed rely on root cause analysis by the people experiencing the problem. So if you are seeking to deploy an innovation in the NHS, the people who really know what the problem is are those working on the wards or those working in the procurement team and the finance team. So it's if you can do the root cause analysis to why are we where we are with that cohort of people who know, you get two benefits. One is that you get a proper answer rooted in the experience, and the second is you get a bunch of people engaged in knowing what the problem is and therefore potentially finding a solution. The second bit that's really critical about adoption that we don't talk about enough, even the people who have got on their soapbox and shouted about this probably haven't done it enough, is adopting proven innovation is as hard as innovating and inventing. It is as hard because it's all rooted in will people change, how will they change, setting that change up successfully. And there's a chunk of content in the book about if you're seeking to develop innovation capability in your public sector organisation, what skills and behaviours and types of people do you need to make a success of that? And there's stuff available, there's help available out there, but not enough of it, and I don't think people know where to look either.
Tell me about Snobovators then.
Yeah, this is the bit of the book where I make absolutely no friends. There are people, and we will all have encountered them. Like I can say this confidently without knowing everything about the sectors in which you've worked, Gordon, or anyone watching and listening the sector in which you work. There will be someone somewhere who is, I'm the innovator. And they're really good at securing conference slots and standing up with a lovely slide presentation and talking about a lot of the innovative work that they have done. And the difficulty with these people is twofold, because it's not as cut and dry as I'm making it sound. So the first difficulty is if people think, like if the innovation director in your organisation thinks innovation's all theirs, you've got a problem of actually it's everyone's business and it's their job to unlock it in others. But you've got the secondary problem of they are doing something a little bit helpful, which you don't want to completely stop. Building the brand of innovation is really difficult. There's people who will ill-define it or try and define it without knowing what its definition is, and it's being muddled a lot at the moment. Government's very obsessed with missions. Keir Starmer's read Mariana Mazzucato's Mission Economy and largely adopted the thinking, and that's great. And there's a lot of innovation thinking within mission delivery methodologies. But the brand needs building. So we need people, charismatic people going out there and flying the flag and beating the drum for innovation.
You mentioned Mariana Mazzucato, and I've heard her mention. I haven't read her books yet, but you're such a fanboy. Tell me why that is.
I am. Yeah, if anyone hasn't seen the book yet, there's a few practical bits at the end of each chapter, and a lot of them are go and read this book, and often they are her books. So I came to her pretty late. Like I didn't follow her entire career. Weirdly, I did my master's with a guy whose partner was her co-author in The Big Con, which is about how the public sector has lent on private sector consultancy to do a lot of its thinking and hollowed out the innovative capacity of the public sector. But her book that I first read was the Times basically did this article on how the Labour Party had swallowed mission economy. And if you're going to work in the public sector and there's about to be or highly likely to be a new government of a certain colour, you kind of want to understand where their thinking is coming from so you can get ahead of the curve. So I read it, and it was incredibly compelling. In the public sector, there are a lot of different kind of approaches to change. Everyone will have done some Prince 2 or some Association of Project Managers, APM, which will give them their project methodology. Then there's transformation teams that are well steeped. There's a lot of improvement stuff now about the incremental optimization. And all of those are often baked into management systems to run public sector organisations. There is very little of that in the innovation space. And what's exciting about it is the mission approach she sets out is the closest we've got to saying, let's take a radical change methodology like innovation and bake it and hardwire it into the way that public sector organisations deliver their services. It's not all the way there, and they know that. And her institute at UCL is starting to fund PhDs in and posts in translating that into actual delivery on the ground. But that's why it's really good. And the Big Con was really good as well. They are a little political. Like you're probably more predisposed to enjoy them if you're a little bit left of centre. But she's amazing. She's worked with the Pope, for crying out loud. Like there's a lot of, and her institute at UCL is the Institute for Innovation in Public Purpose. So a lot of it is how do we deploy innovation and radical change for the betterment of public services, which is compelling to me.
You mentioned earlier, why should government fund a business who can then make money selling their products outside of them being a client? However, I know Mazzucato talked about actually if government are going to fund it, they should own the IP. So how does that balance
It's
then?
really interesting. So her perspective, from what I've read, is definitely risk share, gain share. So if the taxpayer is going to take the risk on a raft of technology or whatever else it's funding, it should also have skin in the game as regards gain share. So if we accept that 90% of the companies we fund in the innovation space are going to fail, but the 10% are going to succeed, taxpayers shouldn't be on the hook to fund the failure, just the failure. It should be on the hook to get some benefit as well. This was rumbling before the election a little bit, so there's been a narrative around neighbourhood working for some time, and this government has started to amp it up a little bit. Wes Streeting has got his 3 shifts, which is analog to digital, sickness to prevention, and hospital to community. The latter 2, partly enabled by the first, are really what you're talking about, which is the way the NHS is set up, or the way it's organically drifted over the last 50 years or so, means that we see people later in what we would call an acuity pathway. So you start here and you're getting sicker, but the trigger points for healthcare intervention or lifestyle intervention should be much earlier than they are, and instead we see you much later when you come to your GP or to A&E in a state of health where we now need to make interventions and they're quite expensive. Whereas a year ago we could have prescribed you a walk 3 times a week. Now we prescribe you a medication you're going to be on forever. So part of it is economic, and we were talking before we press record about the ethical conversation we have in a socialised system where every taxpayer shares the burden of the cost of healthcare, which we might not have if we were in a privately funded system, which, by the way, I don't support for anyone who is worried. But yeah, there is the ask of health systems to say, what could you do differently to be earlier in that pathway? The 2022 Health and Care Act gave the responsibility to hospitals, a share in the responsibility for population health and prevention, which they'd never had before. So previously hospitals you'd come in, you go, no longer our problem. That's changed now. So there's a lot more system working within the integrated care systems. Neighbourhood working helps because it creates these multidisciplinary teams at a much more local footprint that know their population and know their patients and can intervene earlier. And that's bringing in a lot more, like one of the big process innovations is bringing in the voluntary sector a lot more. So Silver Salisbury know a cohort of people much better than any of the health services do and can make interventions much earlier before people are getting unwell. The other big one will of course be technology and digital. It will. So for a while I was Whoop, which is a US wearable company. They've just restarted looking at the health vertical. They had a big pause, but back when they first started looking at the health sector vertical, I was really privileged and fortunate to be on their advisory board for a short time. And a lot of what can be done in that space is absolutely astonishing. To be very specific about it, they published a paper, and it's on their this. It's not a podcast. It is a podcast. Maybe it's a vlog. I don't know. It's on their thing. They talk about it. They measure heart rate variability, and they measured it. They retrospectively looked at the data of 1,000 pregnant women, and you can see the heart rate variability falling. It's as a metric, it should go up if you're getting fitter. So when your body's under stress, you can see it falling. And there's this inflection point in the 3rd trimester where it starts to go back up. And that inflection point was predictable within 24 hours as 8 weeks from birth, which in countries where you've got large distances to travel to have medical help through birth, knowing you're going to have a premature or risky birth, for example, several weeks in advance so that you can be in the proximity of health services would literally save lives. So that's a very acute example of what wearable technology can do. But just the ability to have big data, an understanding of people's biometrics, that's getting more, the fidelity of that technology is getting better and better. That stuff will unlock people's own ownership over their health. I think there is, definitely, and I think people, it's a really political conversation at the moment about how much, like what we do with health data, right? So if the NHS packages up your data and makes a profit off it, is that good because it helps fund the NHS, or is it bad because health data is being sold for profit? It's kind of, I think when we get to a more mature state where the NHS app, for example, is a much more integrated platform, and that's coming, by the way, you will see a lot more of that in the next 12 months, where you can book appointments, whatever. But if you can also be sharing your Apple Watch data or your Fitbit data with your NHS app, and there's AI running in the background that's assessing all of your metrics, that you can get I mean, private insurers do this really well, right? Like Vitality will offer you money off your premium if you're active in a certain way. So we're probably not going to do that, right? But there's going to be ways where we can say through the technology available to us, if you do X, Y, and Z from your very personalised position, your health outcomes will be this much better. And I do wonder if it's a case of saying, you're not as active this month as you were last month. If you get back to that activity level and sustain it for 10 years, you're probably going to live 10 years longer, or whatever the numbers end up being. So I think there is basic information that we can give people without asking a lot from them. I don't know what percentage of the population's got an Apple Watch, but I'm prepared to bet it's pretty high.
Do you think the NHS is in crisis? And also this changing demographic, if it isn't in crisis now, are we, with the demographic bulge from the boomers kind of era, is that coming along and we're not talking enough about it?
I don't know. I think probably everyone who works in the NHS, if they were asked that question any time in the last 30 years, would say yes. I think it's a perma-crisis, or at least the culture has been created that everyone believes it's a perma-crisis. Obviously, Wes Streeting walked into 39 Vic Street and said the NHS is broken, which had a mixed response amongst the people working in the NHS. I do think that politically, there have not been many honest conversations with voters and taxpayers. Again, before we press roll here, you talk about the demographic, the demand increase just from population size alone, and inflation alone does things to health budgets that people will find unpalatable if we don't have a larger pie, either from growth or from taxation, that we can carve out that health budget. The secondary thing is the population demand. So the bulge, if you look at a population, I can't remember what that graph's called with the bars, for Britain, you see this bulge in the boomer age category, and we are getting really good at keeping people alive in complex states, and that's incredibly expensive. When the NHS was founded, retirement age was 59, 60, and the life expectancy of a man was 64. Retirement age is now 68, and the life expectancy of a man is the early 80s. That only places pressure on things like the state pension system and a range of other public services which people access after they cease to become a working taxpayer. But the complexity of the health requirements in those years of your life are just so much more. In Wiltshire, we have a growth demand projected of say 4% for the next year, but that comes almost exclusively from the cohort that requires loads of healthcare. Like, I don't mind if I have a 4% growth in my population for 25-year-olds, because they're very, very unlikely to need the expensive interventions of a hospital. When it's all coming from the 60 to 80-year-olds, they're very highly likely to come and see us, unfortunately. So it's in I don't know if I would use the word crisis. It's definitely in a position where, as a public service, a more honest conversation is needed around, if we want to continue to deliver care in this way for this many people, we're going to need this kind of resource to do it. Or, and this is one of the reasons why I wrote the book, we're going to need to conceive of radically different ways to do those things and deliver that kind of care.
So where do you think these innovation areas will be or should be?
My personal experience and love and hope in that regard is, or my pet passion, I suppose, is cross-sector innovation. So I think if the NHS, as much as we've got the difficulty of spreading between silos and adopting proven innovation, I still think if the NHS had the answers itself, it would have found them. And the thing that requires real humble leadership is the NHS to go, I don't think we can do this ourselves. I don't think we know how. And certainly I think that the way that leadership has developed in the NHS over the last 10 years and the competitive environment that used to exist, I don't think that the leaders have been set up in their development for this kind of thinking. So I think it's a case of looking for answers where we would never have looked for them before. So I talk a little bit about in the book the Future Hospitals Initiative, which was a collaboration between the European Space Agency, UK Space Agency and Hampshire Hospitals when their new hospital programme was getting started. And that was a collaboration that we anticipated would yield literally no interest. The question to the space sector was, what of your skills and capabilities can you bring to bear for the development of a new hospital and its services? And we expected radio silence. And instead, we got tens of world-first ideas. Some of them are not directly related to solving the grand challenges of the NHS, right? But some of them were pretty good. The blending of space data and terrestrial data with the advanced computational skill that often exists in big data industries like the space sector, to look at population health differently, right? So what we can't do is, we know where people are experiencing bad outcomes, often in more deprived areas, and we're sort of sometimes able to go and do stuff like go and run a lipid clinic in one of your poorest areas, or put on extra resource to be in touch with communities that don't otherwise access health services. But we're not very good at tracking those interventions. They're not very real time. They often rely on census data or annual data. So there's capabilities from that particular project example where satellite data was helping with a much more real time tracking of population health intervention. No one had thought of that. Right?
Yeah.
And there were a range of other examples like that. So when health looks to other sectors that it maybe has never thought of partnering with before, defence maybe being one, I don't know, there'll probably be stuff there. What that requires in a behaviour way is a bunch of leaders to go, I have no idea if there's going to be these answers out there, but I'm going to go and try anyway, while at the same time as those leaders are asked to manage incredibly pressured services with limited resources, where the time to do that is either not available or be viewed a certain way. So, not easy.
There was one phrase in the book I'm curious about that you said, innovation leaps you to the worst, best place. Can you expand on that, and also how the change family and where innovation fits in and is supported?
Yeah, sure. I can't take full credit for the logic. I stole it from Kaiser Permanente, who are a health group in the US, and I think they stole it from someone else as well. So I'm not sure who to accredit the idea to. But in the book, there's a graph, and if you can imagine it in your mind's eye, improvement is the incremental optimization of a thing we do already, right? It's the athletes do it. If you're really great at something and you get 1% better every day, you make good gains over time. And if you imagine that on a graph, that little improvement all the way. But the reality is, a lot of us will top out. You'll optimize the thing you do far enough. There is only so fast human legs can move, right? You can only run so fast. The human body reaches a limit. Innovation leaping you to the next worst place is somebody inventing the car. So you get to this place where you've got this internal combustion engine that's completely inefficient, but you can get in it. You don't have to run anymore, and you can go really fast. And then the incremental optimization happens after that. The thing gets more aerodynamic, the engine gets more efficient, the car gets faster and faster and faster, and you end up with modern day Formula One or whatever. So the idea that public services do rely a lot on improvement, because it's very tangible for the frontline workforce. What can I do, a small thing today, to make a difference to improve my service? This little idea that can change processes on my ward, or how we deal with prisoners in this environment, or on the battlefield, how much better can this weapon be? It's tangible, it's impactful, it's easy to grasp. Innovation is that other thing that takes you to a much better place, but it then needs that approach. It needs that optimization beyond that. So part of the Snobovator problem, the point I forgot to mention earlier, is that we need to accept that we shouldn't be, for want of a better phrase, slagging off the other members of the change family. So there'll be people who stand up at conferences, and I went to one recently at the London Design Museum, and this guy was an innovation leader, and he stood up at the end and he said, oh, and don't forget, the light bulb didn't come from the incremental optimization of the candle, and everyone was, oh, this is such great thought leadership. Actually, what that disrespects is all the incremental optimization in the development of the light bulb, and the development of the light bulb since its invention. So if we conceive of and I'm sort of thinking about this from quite a health-focused perspective. This is slightly different in other bits of the public sector, but broadly speaking, there's a change family of research, audit, transformation, improvement, and innovation. And they all have a role to play, and no one is more important or better than the other. You need them all to interlace and understand each other. And sadly, we've got a lot of teams across the public sector who are the improvement team or the transformation team, and they don't always want to play nicely with each other. And some innovation leaders are guilty of that more than anyone. But yeah, improvements being the incremental optimization, research is the acquisition of fundamental new knowledge, audit being the testing of what you're doing to identify where there's a big opportunity for change, transformation being a start and end point with known states, so you know exactly what you're going to end up with and where you're starting, and innovation being a much more ideative, co-creative process where you start in a place, know you want to be somewhere different, but don't necessarily know exactly where you're going to end up.
So I didn't want to give away everything in the book, So is there any final thoughts or comments you want to share?
I mean, have a read if you can. That would be very flattering. Like I said up top, the central thesis of the book is that innovation is not dead. It is around. It's a case of finding it and spreading it, and the recognition that that's really hard. So what's in there are some tips and tricks on how to go about developing that capability, whether it's skill, behaviour, competency, whatever. But I would just say that you don't necessarily need those things to get started. It's best to begin with the belief that this is probably what we need to do. If you look around at the public services on offer to you in Britain or anywhere else in the world and think, oh, this isn't quite right, this could be better, then we are of like mind and there's something for you in here.
Thanks, Tony. Thank you for your time.